When a customer comes in with a prescription for vision correction, what percentage of the time do they leave with glasses and what percentage of the time do they leave with contacts?
About 50% with glasses and 50% will leave with contact lenses.
So why would you recommend glasses for a patient?
Well, I'll recommend glasses for all patients, just because they need to wear glasses. Contact lens patients shouldn't be wearing contacts 100% of the time.
Okay. So why would you recommend contact lenses for someone?
Some patients are very myopic, very hyperopic, their glasses are very thick. Their vision isn't quite as good in those cases with glasses as they are with contacts. I would also recommend to patients that are active in sports. Contact lenses work excellent in sports.
Would you recommend one brand of contact lenses over another?
Yes.
Which brand do you usually recommend?
90% of our patients wear SIBO lenses.
Okay. What do you think is the biggest gap in knowledge among your customers when it comes to eye health?
I think the average patient thinks that they don't need to come in on a yearly basis because as long as they're seeing, they think they're seeing all right, that everything's fine, and that isn't necessarily the case. Many underlying factors could be going on. They could be losing vision and not knowing it until it's too late.
So how often would you suggest someone comes in for an eye checkup?
I think it's important that at least once a year a patient comes in to get the health of their eye checked.
Okay. So when a teenager wants contact lenses, what factors into whether they leave your office with those lenses or not?
I'll generally take a visual picture in my head of that particular patient, see if they're coming in with their parents, what their physical appearance looks like. I'll question about how their grades are. I kind of joke around with them to get a feel for what this patient's really all about. If I see that they're really good, they're good students, they have a good relationship with their parents, and they keep themselves clean, then I'll generally recommend contact lenses.
Okay. If a customer complains about the comfort of their lenses, what's your most common response?
I'll generally start asking them questions such as, when do the lenses feel uncomfortable? Are they uncomfortable at night? Are they uncomfortable at work? Are they uncomfortable maybe after you're exercising? And I generally will wait to hear their responses to give them some answers.
And then what would you suggest depending on some of their responses?
For example, if a patient tells me they're uncomfortable in the evening, I'll generally tell them to take them out because they've probably been wearing them all day. Contact lenses should not be worn, in my opinion, on an 18 or 20-hour basis. The eye needs to breathe, and contact lenses need to be taken out, and they need to wear glasses.
Do you have any other recommendations for if they're just feeling discomfort throughout the day?
Yes, they can use eye drops. They can drink more fluids. Many patients will complain that when they're exercising, their eyes start to bother them. The lenses are bothering them. Many times it's not the lenses that is the problem. It's the body gets dehydrated while they're exercising, so they need to drink plenty of fluids.
What's one message that a contact lens manufacturer can deliver to consumers to make your job easier?
Okay. It would not only make my job easier, it would probably make it a little bit more profitable. But I think the contact lens manufacturers need to stress that they need to see their practitioner more often than even once a year. Definitely not to overwear the lenses. Many contact lens patients, many do, at least 50%, overwear the lenses, and if a lens is marketed as a 2-week lens, many think that as long as the lens feels comfortable or they can get by, they can push it for a month, and that saves them money.
Okay. Are you involved with any causes in your community currently?
Not at this time.
Okay. If a contact lens manufacturer was interested in getting involved in the community, where do you think would be the best place for them to do so?
I think the best place would be like a community health center where many patients will go that don't have insurance and can't afford it, and the patients that possibly that really need eye treatment or contact lenses or glasses that can't afford it, I think that would be great for the contact lens companies to get involved with those clinics, and I would be more than willing to get involved with them as well.
So going off that, who in your community do you think would benefit most from a gift of free contact lenses?
People that don't have the means to afford them.
Okay. Do you think that contact lenses provide better vision than glasses?
No.
Why not?
I can only speak as experience because I've worn contacts, and from what I hear from patients, but from my own experience, when you wear contacts, the vision can fluctuate depending how you tear, what the conditions in the room are that you're in. Many offices, air conditioning, heating, all that affects the tear flow. It affects the air that's on the eye, and it can dry out your lenses.
What do you see as the link between healthy eyes and healthy lives?
I think if a patient is taking good care of their eyes, and that means with the contact lenses, wearing them exactly the way they're supposed to, cleaning them on a daily basis, keeping them in a case, keeping the case clean. I think a patient that goes through those steps, washing their hands thoroughly when they're taking care of their eyes, that type of patient, I think, in my opinion, is going to take better care of their health.
Okay. Do you currently wear contacts?
No.
Okay. Are you aware of any specific initiatives to reach diabetics with healthy eye care messages?
Not at this point from the contact lens companies, and I think it would be helpful if the contact lens companies would have brochures given to the practitioners to possibly give some guidelines for diabetics. Myself as a practitioner, keep a close eye on contact lens patients. Generally do not give them too many lenses at one time, and won't refill it until I see them again.
Okay, so then as an optometrist, do you feel comfortable engaging with your customers about health issues such as diabetes?
Yes, I do.
Oh. Thank
Good.
you.
And for the record, state your name and spell your last name for us.
You want my name?
Yes.
Manley Simms. Simms.